All right, so I'm joined today by Brandon Schmitt. He works for Professional PT in New York, and he's also the chair of the NESIG. So, Brandon, thanks for joining us today.
My pleasure. Thanks for having me.
So, first, I want to start out by kind of asking you a little bit about your current position and your career path to where you are today.
Yeah, absolutely. So I got my undergrad degree in athletic training, and then I went on to PT school at Slippery Rock University. And on one of my affiliations, I came here where I'm at now to Westchester County, New York, and worked with Tim Tyler, who really took me under his wing and showed me the ropes. And it was really like a residency here. I spent a lot of time working with college athletes, professional athletes, working very closely with Dr. Nicholas and his group, a lot of sideline coverage. And he offered me a job, and I came here, and I chose to come here because I could do clinical research. I could do coverage as an athletic trainer. So most of my career, I've worked both as an athletic trainer and a physical therapist. So I've got to keep one foot in both of those worlds, which has been really great. And I got started out early on in the what was then the sports section and now the academy. And piece of advice for all of you early career professionals out there and students is to really get involved in the academy early, because the leadership really took me under their wings and they helped me to get involved, and just a really, really great group of individuals who just want to see the profession succeed and love what they do. And that allowed me to get involved to the point where I am now as the special interest group chair for the knee. So that's how I got where I am.
Awesome. Can you kind of tell us a little bit about the NESIG, and then maybe also after that some projects that you guys are currently working on or focused on?
Yeah, absolutely. So as the name suggests, we're about all things knee, and that means everything from post-op knees, like multi-ligamentous knee injuries and ACLs, to non-operative knees, where we have people with patellofemoral pain, OA, things like that. And it's not just the knee, it's because we don't treat the body part. Obviously, we treat the athlete and the patient, but mostly focused on lower extremity. And one of our goals in the NESIG is to give our members actionable items, things they can actually use. So, yeah, we create a theory base, and we delve pretty deeply into literature. But at the end of the day, the question is, how can I apply what I learned here, and how can this help me to be a better practitioner and give me more things to use in the clinical setting on a day to day basis? And that has driven a lot of what we're doing now. So, for example, we have something we call TheraX Thursday. So every Thursday we post therapeutic exercise, something you can look at, you can kind of pick apart. Oftentimes it's accompanied by some evidence and some discussion, and then you can apply that into your clinical practice. We put up some clinical pearls. I generally like to, when I come across some thought-provoking research that comes out, put that up and really try to facilitate a discussion and call some things to the members' attention. I think things that are important for us to know. And we have a library of content that continues to grow. We've done a series of Ask Me Anything where we fielded questions from our membership, and we've had surgeons and physical therapists of different specialty areas and answer all the questions related to that. And that actually is still up on the Academy website. That is, information is all archived, and that's good to check out, to have some content in some specific areas if it interests anybody listening to that. And we have newsletters that we've been working on. They've been the last several that we've sent out over the past 2 years or so have been content driven. So we've tried to follow a theme there, and we can build off of that theme. And what we're trying to do is drive that to mobilize and transfer that so we can have a discussion. Because a big part of what we want to do, and this is going to require everybody listening to really help out and get involved, is to facilitate discussions and to talk about things, to talk about our tough clinical cases, to pick people's brains who've had certain experiences, what works for you, what doesn't work for you, what are you seeing? Are we getting internal braces? Are you seeing multi-legs? How are you handling them? And we can really learn from each other. So we're trying to build a good library of information and make it a place where people feel comfortable to come and ask questions and to give comments. And I don't want it to be an atmosphere of sometimes you see on Twitter where it's calling people out and one upmanship. And we really want it to be a collaborative endeavor where people can ask questions and learn and get exposure and talk to people who have certain subspecialty areas and learn from them. For example, at the meeting, the AMSC meeting we just came from, we had a group do a multi-lig talk. Joe Munson's group out of Minneapolis, and they just gave a great talk. And I'm furiously scribbling all these things down that were really good things I could take back. And I coincidentally had a multi-lig in the clinic that I was seeing that week, and I could use that information. So that's what we want to present. We want digestible things that can actually be used for the clinicians, boots on the ground, so to speak. And that's driven a lot of what we're doing. Going forward, we have some more interview series coming up with Courtney, I think, is going to interview some surgeons, Courtney Bond, and she got a number of therapists that she's going to talk to. And we're always open for suggestions. If you have certain people that you want to hear from, we'll get those folks on and ask the questions and try to give you what you want. The feedback's great. Lots of feedback from everyone. Please delve into the content, and we'll continue to put that out as we go forward.
Awesome. And where can people find those Therex Thursdays and Clinical Pearls? Is that through your social media?
Yeah, that's on the Mobilize site. So if you're not a member of Mobilize, get on Mobilize because there's a lot there. And the idea is it's a forum, so we can have discussions. We can talk to each other and get a good dialogue going. So that's all there, and you can actually search by content. So if you want all the Therex, you can type in Therex at the top, and you can find all the Therex. If you want to ask me anything, you can type Ask Me Anything, and you get all the Ask Me Anything that we've done. So it's the easiest way. We can't really archive on Mobilize, but it's a way to see all the content.
Sounds great. And then if you're an ECP and you want to kind of get involved in the SIG, what are some ways to get involved?
The easiest way and the best way, what we're really looking for now, is to get on the Mobilize and join in the discussion. Don't be afraid to ask questions. If you have a challenging case, put it up there and ask for help and guidance. When we put on, we don't do full literature reviews because they're really hard to facilitate, I think, but we'll post different articles that are coming out in the literature and make some comments, ask some questions. If you have the time to review that yourself and you have some questions about it, put it on there. So really facilitate discussion. We want to get that going because I know that we have some more senior members and we have some more seasoned veterans who are there ready to answer some questions and give guidance to the early career professionals. But don't be afraid to post, and don't worry, there are no questions that you should be embarrassed to ask, or we're all here to help each other. We're all working together, and you can do that. If you have more something else you want to pursue as far as projects, or you have an idea, definitely reach out to me. You can post on Mobilize. You can email me. My email is on the Academy website, and I can give that to you as well. So you can post that. But really don't be afraid to get involved. We're always looking for therapeutic exercise Thursdays, for example, clinical pearls, those little tidbits where you have a little trick that you use and it's 20, 30 seconds and you can film that and you can put some evidence to supporting that on. We love stuff like that, trying to build up an archive of those things so that we can post those, once or twice a week so that we can really keep putting some good quality content.
Awesome. And then I was wondering if you had any advice for students, and then also advice for clinicians in their first couple of years of practice, because things obviously change so much in those first throughout kind of those first 5 years of your uh your life in the physical therapy world.
Yes, I always remember something that my mentor, Tim Tyler, told me. He'd say, "You don't know anything until you're 5 years out." Now, obviously, you do know some stuff, but it's really important to remember that you can have all the textbook knowledge in the world, but you have to have the experience. You have to see the patient. So it's really important to have a good mentor, to find a place where you can have somebody who can mentor you, that can help you out, they can push you. I was always pushed along the way, sometimes grudgingly, sometimes kicked right into the fire. But I think that exposure really helped me to grow, and it put me in a place where it wasn't always comfortable, but it forced me to up my game, so to speak. So find a mentor and don't be afraid to get involved. In the academy, everyone is willing to help. They're very accepting. It's really a great place. I don't know if it's like that in every profession, but in sports physical therapy, it certainly is. And one more thing clinically I would recommend is make sure at the beginning you master the basics. It's really important. Get a good foundational knowledge, good foundational clinical skills before you try to do all these fun and exciting, sexy things where you're on a balance board and you're juggling flaming chainsaws. There's a place for that, but first you really want to get the fundamentals down. So make sure you take the time, learn fundamentals, and get a good solid foundation. And then you can go off and you can do some of these niche things, and you can do some of these crazier things. But basics first.
Absolutely. Well, thanks for joining us today. Did you have any other kind of final thoughts or things you'd like to add?
Thanks for having me again, and don't be afraid to reach out and get involved. We're really trying to get people on Mobilize so we can have some good discussions. I know there's a lot of things personally that I want to learn from you all, and I won't be able to do that unless you share with us on Mobilize. So start sharing, start getting involved. There's a place and there's a role for everybody. So please don't be shy.
All right. Thanks so much, Brandon. Appreciate it.
Absolutely, Colin. Thank you very much. Have a great day. Thanks for doing these.
Of course. You too.
All right. Be
All right.
well.
You too. Bye.